Here comes the proper way to do a cheek enhancement, and you are going to see the AAFE Safe Injection Perfection Protocol in use right now. So patient is cleaning up really well. We know exactly where we want to go because we really assessed the patient ahead of time, and now you are going to see very careful injections that are going to go down to bone. And we are going to place some bolus injections in this technique, going to go down to bone, tap on it, pull back a little bit, then aspirate as you just saw. And now just go ahead and place no more than 0.1 ml in each one of these areas. And we are going to carefully watch the tissue. And like you see, you can certainly get bleeding, and you're just going to go ahead and hold it down and just stop the bleeding there, because many times you can just go ahead and nick some of the facial vasculature there, and that is what's going to give you some bleeding, but it'll stop fairly quickly and we will continue on here. But you really have to know your anatomy. Here we are close, but not close enough to the infraorbital foramen, so you've got to know what comes out of it. Aspiration, low and slow pressure. You're going to watch the tissue. Keep watching that tissue. That's what's so important. The aspiration, even if we saw something come through on the aspiration, we would not rely completely on it. We would go ahead and move our tip, but every time you move that tip, your aspiration, it doesn't mean anything anymore, which is why we do aspiration, but we never rely on aspiration, especially with all the evidence showing that it's wrong 70% of the time. So you always want to assume that you are in a high-risk area, and that's why low and slow and watching the tissue, never more than 0.1 ml in each one of these things, and watching it come through and just going ahead and delivering it. Watch the tissue. You want to watch the tissue anyway, not just for any color changes. You want to see that fill that's going on here. Now, as you see, we are placing it on bone, and if you are not tapping bone and not right above the bone, which means you're underneath muscle, you're underneath all the other tissues, and you want to use a medium to a heavy filler that will really go ahead and push up. If you are not touching bone, then you are in no man's land, and you are just going to place filler, and you could place a dozen syringes of filler, but you're really not going to go ahead and get anything out of it because it's got to be backed by the foundation of bone. So bone, filler, that filler then pushing up, and with something with a medium to a high G prime preferably, then that is going to go ahead and push up on the tissue, and that's how you get a great cheek enhancement. You can see that is happening right now, right there on this patient. Now we're just going to go ahead and work our way back a little bit. Bolus injections, we're going to smooth it all together by the time you're done, and placing the finger under the zygoma so that you know you are exactly where you should be. So we're going to really go ahead and map out that zygoma even during the procedure. We're going to go ahead and feel it to make sure we're in the right place. But that needle tip, if it's not touching or tapping bone and then pulling away from it, you never want to inject underneath the periosteum. You always want to be right above supraperiosteal so you can touch it and then pull back so you know where you are. Aspirate low and slow, never more than 0.1, sometimes only 0.05, but keep watching that tissue. And that tissue looks nice and healthy, so we know that the filler is going exactly where we want it as we go ahead. Now we're talking about also blending that cheek, and especially the lid cheek junction as it goes into the tear trough and around the eye. That's what's important, and that's what you get as you go ahead and start blending this whole area together. It should not just be lumps and lumps and lumps of filler. It should really be nice and blended all the way together. Keep assessing throughout the entire procedure. You need to know exactly where you're at, exactly what you're doing. Have the patient go into different positions, and you go ahead and move around. And don't forget, these fillers are going to go ahead and absorb water, and the patient, depending on the patient's history, can get a little swollen, no swelling, or can get quite swollen. It really just depends on the patient ahead of time and what they are doing and really what their histamine response is going to be, which we sometimes can help mitigate, but really don't have a lot of control over, especially when it is a visible area just like this. And again, as you come to the anterior, I hope you understand, anatomy is everything. Technique is everything. Safety is everything, but there's so much that you can do for patients. Cheek enhancements are amazing as they really go ahead and replace the volume in the mid-face when the patient has lost volume. If it's just a lack of volume, we would probably go ahead and use some solid filler smooth PO threads, but great job on this side, and we will show you the side-by-side result where only the right side is done on the left side of your screen as opposed to the other side. And again, it's going to need to heal up. This is immediate post-injection here, and now we'll show you both sides immediate post-injection, as you can see, to bring that out. One side might be a little more swollen than the other side. Patient will heal up. She was thrilled with the results. Time for you to add this to your practice and time for you to get AAFE certification trained today.